everyone, welcome back to another video. This is hip bone simplified. So let's begin with the topic. Hip bone. Hip bone is also called ox coccyx. It is made up of ilium, ischium, pubis. These three are large flat bones. Pelvic girdle. तो pelvic girdle किससे बना होता है? राइट हिप बोन, लेफ्ट हिप बोन, sacrum, 1 or 2 coccygeal vertebrae. So this all consist of pelvic girdle. Acetabular cavity. Acetabular cavity is the cavity where 3 bones join together and it articulates with the head of femur. Pelvic symphysis क्या है? Hip bone of one side join with the hip bone of other side. तो hip bone जैसे कि हमने देखा था, it is made up of ilium, ischium and pubis. तो देखते हैं what ilium consists of. Ilium. Ilium is also called upper part. Ilium, which is the upper part, we can also name it as wing. It is made up of wing, upper part and distal angle shaft. It has got 2 surfaces, 3 borders and 3 angles. 2 surfaces. First is gluteal and another is pelvic. Gluteal surface. So gluteal surface is smooth, concave. It consists of transverse ridge parallel to the lateral border. This is called gluteal line. It continues with the superior ischiatic spine. Pelvic surface. It is triangular area at the medial aspect of the wing. Medially, it articulates with the sacrum. And lateral part remains covered with the iliacus muscle. Shaft. Here psoas tubercle is present. Now let's come to the borders. It has got 3 borders and those are dorsal, lateral and medial. So dorsal border is thin, concave. Lateral border is thin, is rough. It is also concave as it is a triangular bone. So dorsal and lateral borders are thin, concave. Lateral border is also thin, concave. Medial. Medial border is concave. At the beginning of the shaft divides into anterior pubic part, which is called pubis. Posterior ischiatic part, greater ischiatic notch is present and is raised on the cotyloid cavity. Superior ischiatic spine is also present with psoas tubercle. Last part of ilium is 3 angles. It has got 3 angles: external angle, internal angle, distal angle. External angle is called tuber coccyx. Internal angle is called tuber sacral and distal angle is called cotyloid cavity. So this is the diagram of the hip bone. This is the hip bone and we were talking about ilium. So ilium consists of internal angle. This is internal angle of ilium. This is the external angle of the ilium and here this gluteal line is present. At the medial side, psoas tubercle is present and lateral border is concave. All the 3 borders are concave. Lateral border consists of superior ischiatic spine and greater ischiatic notch is present at the medial border. We can measure the diameter with 2 parameters, that is transverse diameter and conjugate diameter. So this was ilium, posterior dorsal view of ilium, and this is the anterior view of the ischium. Anterior view represents tuber coccyx, tuber sacral, anterior articular area for wings of sacrum. So this is the articular area, and the distal part of the shaft also consists of supraacetabular fossa. So this was all about ilium.